What's up, everybody? Courtney Morris, Natural Wellness Physiotherapy. Here with Griffin. Jay, he's our strength coach and our client liaison here at Natural Wellness Physiotherapy. Griffin's kind of coming off of a powerlifting cycle. Amongst other things, he's got like a little bit of this lateral epicondyle soreness. Basically, when we hear the suffix itis, it means inflammation, right? And when we generally think about inflammation, we always kind of think of it as a bad thing. Like, take your anti-inflammatories, put some ice on it. Truthfully, inflammation is the very first step of the healing process, right? Is that when we have some kind of nick or some kind of cut or some kind of injury, is that we have chemicals in our blood that rush to that area and make it tender and puffy and swollen and say, hey, don't mess with this area, it's hurt, right? What happens when we have something that's chronic and ongoing like this, it's like we've had the initial insult, but we continue to irritate it, right? He's continuing to bench, he's continuing to work out, and so it's not getting the adequate amount of the proper stimuli for it to kind of continue the healing cycle. And so what we're going to kind of do is we're going to use a process called IASTM, or instrument-aided soft tissue mobilization, or gua sha, or like there's like 10 different names of something they're all pretty similar. So what we're going to do is we're going to take a look at that part today and kind of reset his own anti-inflammatory system so he can use his own anti-inflammatories to go clean up this mess. It's almost like taking the scab and ripping it off is irritating that tissue a little bit, so those chemicals in his body know, like, hey, we still have some work to do. So most of his pain is located here at the lateral epicondyle. Now, what I will see a lot of physical therapists will do is they're like, oh, pain's here, and they'll work on this, or they'll work down to the forearm, and they're missing the other muscles that attach right in through here. So I'm going to have him pull the sleeve up, and we're going to go spend a fair amount of time in the tricep as well too. So when we're doing this process, what we'll use some cocoa butter going through here, assuming that you're not allergic to cocoa butter. What a miserable existence if you are. So we apply this cocoa butter into this region. All right. And so that's just going to help my tools slide and glide a little bit easier through here. So we put a little bit of tension on through here, but I'm going to go over the top of that lateral epicondyle bone itself. So we're going to go in through here. Now, this, like most of the other treatments that I do, doesn't feel very good. Griffin's going to be a good example of somebody that has a little bit more fair skin. They're going to turn a lot more red more quickly than some of the rest of us will. But what it should show us in certain areas is that he's going to turn more red in areas that are more inflamed. And so as we go through this forearm part itself, like, this is kind of a normal amount of redness. There's not a whole heck of a lot going through here. So my inclination is that even though his pain he feels right through here, it's coming from higher up in the chain. So let's go take a look up and through here. So as we get into here, our tissue texture changes a little bit. It's a little bit more gritty, a little bit more bumpy, not as smooth as we're going through here. So even right away, we're going to start seeing, like, this is going to look like a little bit of a bruise. And that's okay. That's not our goal. That's not our target, is to bruise you up and make you look like we maimed you every time that you came in. But it is a good indication that your tissues are angry and they're not doing what they're supposed to do. And so as we go through here, we'll kind of go down, we'll go over the top of these, of the lateral epicondyle itself. Good. And then we're going to work our way back up that other direction. And most of the stuff that we see and most of the stuff that I feel is actually centered right in through here. What does that feel like to you?
Painful.
Painful?
Yeah.
How is it down through here?
This is fine.
Right. So even though he's feeling some of this pain, it's probably referred from up in this area up and through here. So we'll finish our treatment, but in the meantime, this works really, really well on things that end in the word itis, like rotator cuff tendonitis, patellar tendonitis, any of these kind of different types of areas where you feel inflammation. This is a really nice tool for you to reset and use your own body's anti-inflammatory to go in there and clean up the mess. If you have questions about it, or if you've had that, or if you have bruises from me, leave those in the comments below, just because I like to see my own handiwork sometimes. So until next time, Courtney Morris, Natural Wellness Physiotherapy.